Diuretic therapy. This is actually a very interesting topic. We use them for a number of reasons. One, it's actually we use it for blood pressure, and we use it for volume control for people who have congestive heart failure. Those are the two big reasons. It's funny, it's a life-saving medication. Some people love them, some people hate them, and we're going to talk about the pluses and minuses of diuretic therapy. They're a really integral part of management of high blood pressure and the cornerstone to management of congestive heart failure. One of the things that I see, the biggest mistake that most patients and many physicians do is we don't use enough of them. We don't use the proper doses. We underdose them. If your basement is flooded with water, and you have to pump out the water, and if your lungs are full of fluid, you got to pump them out. So we have to get good control of this. And if you have high blood pressure, we can get you a new steady state, and it's a key medication. They're wonderful. Let's hear a bit more. The team's really put together a wonderful presentation. I'm really looking forward to this. I'm sure you will too. Take it away.
All right. Thank you for that, Dr. Curnew. So as he mentioned, today's conversation is just going to be about diuretic therapy. So the question is, why do we care about them? Why do we use them? What are they for? And what are they used to treat? So if we just take a look at, what we're going to be talking about today, we're going to start off about, a brief conversation about what they are. We're going to talk about blood pressure, how it's used to control blood pressure or homeostasis, and its mechanism of action. We're then going to talk about some examples of diuretics, the naming conventions, some generic versus brand names for diuretics. We're then going to talk about, what are they used for, what conditions do they treat, and how do they treat those conditions. And lastly, we're going to talk about some side effects, some common side effects and drug-drug interactions you might see if you do take a diuretic. One of the things that we do want to say is, a lot of people can question, why is this important? And Dr. Curnew mentioned it. It's really important to understand some important details of how your medications work. That can help, medication errors. It can help prevent poor interactions, and it can help you understand what kind of things to look for if there is an issue.
I'm going to preface, if I put you on a diuretic and you're having an issue, please contact me. One thing I'll say is that I don't play with my electric panel. These are crucial medications, and I see so many mistakes made in this area. Other over underused. Most of them are underutilized, but it can affect electrolytes. It can cause all sorts of issues. And if you take a water pill properly, you will not go to the bathroom more. I'll repeat that. If you take a diuretic properly, you'll get to a new steady state, and you'll stay at that. If you stop and start, you're going to have a problem. So let us work together in this area. And perfect. Tell us more.
Awesome. And so, yeah, another part of that is just, make sure you guys ask plenty of questions. If you have anything that you're confused by or you want to know more about, please feel free to, unmute your microphone, ask a quick question, or just drop the question in the chat and let us know. We'll be able to get to it either at the end of the presentation or if we just see it during the presentation. With that being said, I'm going to hand it off to our volunteer, Awesome, here.
Hi, everyone. Welcome. So before we get into, what diuretics are and how they function, we're going to talk a bit about, what is blood pressure and how our kidneys work in terms of regulating blood pressure. Next slide. So what is blood pressure? Blood pressure is the pressure of blood pushing against the walls of your arteries. And arteries are the vessels that carry blood from your heart to other parts of your body. So how is it measured? Well, the first number is the systolic blood pressure. It measures the pressure of your arteries when your heart is beating. And then we have diastolic blood pressure, which measures the pressure of your arteries when your heart is resting in between beats. So that diastolic number ideally should be lower than your systolic. And how do we read blood pressure? Well, if we have something like 120/80, that's 120 systolic over 80 diastolic. And that's in the measurement of millimeters of mercury. Next slide. So what is high blood pressure, or how we call it hypertension? A normal blood pressure level is regularly under 120/80, 110/70. And having high blood pressure means that you're consistently above this 120/80, or as we call it, hypertension. So the higher your blood pressure levels are, the more risk you have for other health problems, specifically heart disease, heart attack, and stroke. And according to the CDC guidelines from 2017, A high blood pressure is if you regularly are measuring over 130/80. So high blood pressure doesn't usually have too many signs or symptoms that are very evident. So it's important to regularly check it. And it's not really one instance that matters. It's about the average. So it's important to do this regularly and see if you're above that threshold.
So thank you for sharing that. So I'll preface saying that the ideal blood pressure is 110/70. That's measured at home in a relaxed environment on multiple readings on multiple occasions. And what I see is that your blood pressure can be 170/100 one moment, and it can be a number of hours later 120/80. That's normal. Blood pressure fluctuates, and so when you come to the doctor's office, very few blood pressures is if you like it to be, because you want to measure multiple blood pressure readings. So one key to everybody's success is to have their home blood pressure machine and learn how to use it. We have lots of videos on this, and I encourage people to measure blood pressure often, many times. We can do a 24-hour blood pressure machine, but you'll have to pay for that. I think you're better off buying your own machine, approved by Hypertension Canada, and look at that. For every 10 millimeters difference in blood pressure, that translates to a reduction in congestive heart failure by about 30%, heart attacks by about 20%, strokes by 30%. So it's really has a great impact. It's a very reversible and treatable form of longevity, from Alzheimer's disease to kidney disease to heart disease to stroke. So please, 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 when someone says, I don't have a blood pressure machine, well, I think you're sacrificing your health. So I would find a way. And if you can't afford one, go to the pharmacist. If you want one, we can lend you a blood pressure machine for a month or so. But that's really important. There are now apps that measure blood pressure. Unfortunately, this technology is not mature, and that needs to be upgraded. But I think soon in the future. We used to have a machine or an app that looked at your face and looked at pulsation and measured blood pressure, but that was found to be inaccurate. So that's too bad. But we'll keep learning about that. So go ahead, tell us more.
Yeah, thank you so much. Next slide. Yeah, so what causes high blood pressure? And just as Dr. Curnew said, high blood pressure develops over time, and it's the average of a regularly measured value, right? And it happens because of a lot of unhealthy lifestyle choices, right? We'll talk about how we can manage and prevent it later on, but just giving you examples: not getting enough physical activity, so not making your heart work and improving your blood circulation. If you suffer from diabetes or obesity, that's another risk factor, or even during pregnancy-related complications. So these are just a few examples of what causes high blood pressure and how it develops over time. Next slide. So what problems does high blood pressure cause? And it can really damage your body in several ways. And there's three main things I want to touch on. Firstly, heart attack and heart disease. High blood pressure can damage your arteries because you're putting all that pressure against the wall, and it's making your arteries less elastic. It's decreasing the flow of blood and oxygen to your heart, which leads to heart disease. So because you have this decreased blood flow to your heart, you can suffer from chest pain, also as we call it angina, heart attacks, which is when there's a lack of blood supply to your heart, and your heart muscles begin to die because there's no oxygen, there's no blood being carried there, or even heart failure, which is a condition when your heart's not pumping enough blood and all your other organs are suffering. So these are just some examples. The second main thing of what high blood pressure can cause is stroke, or potential brain-related complications. So high blood pressure causes the arteries that supply blood and oxygen to the brain to be potentially bursted or even blocked, which causes a stroke. And a stroke is when your brain isn't getting enough oxygen supply because of that lack of blood flow, and your brain cells are dying. This could be very severe. It could lead to disabilities in speech and movement and other basic activities, and it can, in the worst cases, even be deadly. And also, Dr. Curnew mentioned Alzheimer's. Having high blood pressure, especially in your later stages of life, has evidence showing that it's being linked to cognitive disabilities like dementia. Lastly, I want to talk about kidney disease. Especially if you do have diabetes, high blood pressure gives you a higher risk of developing chronic kidney disease, which is CKD. And we'll talk about the connection between your kidneys and high blood pressure, as this topic is on diuretics, which works through your kidneys. Next slide. So really quickly, what are ways that you can implement within your daily life to manage your high blood pressure? And these are things that we always recommend at the clinic. Number one is eating that healthy diet, right? You want to limit your salt intake, and we'll talk about why salt is so important. You want to limit your alcohol consumption, eat a variety of foods that are rich in potassium, in fiber and protein, and low in saturated fats. Secondly, you want to keep a healthy weight, right? That's where you measure your weight at the clinic, is because you want to know where your BMI falls in. And BMI is something that you can simply calculate at home, or you can even ask us at the clinic when we do measure your weight. Number three, getting regular physical activity. You want to keep your heart working and the blood flowing. Number four, you don't want to smoke, right? Smoking, there's evidence that shows smoking raises your blood pressure and puts you at a higher risk for heart attack and stroke. You want to manage stress, right? Stress stimulates your sympathetic nervous system. And a great way to reduce your stress is make sure you get enough sleep. And lastly, and that's why you come to the clinic, is medication. Medication that manages blood pressure, you can do it through several ways. Number one, you can remove water and salts, you can relax your vessels, and you can make your heart beat with less force.
So it's kind of interesting is that some of these things are important. You mentioned body mass index, best body mass index 20 to 25. There's actually data from China now that is that salt substitutes, which are rich in potassium. So potassium lowers blood pressure, sodium brings up blood pressure. And one major source of salt is actually bread, for instance. I love bread. There are certain recipes where we're trying to experiment, mostly from Scandinavia, that are rich in potassium, because you need a certain amount of salt for yeast to rise and things of that nature as well. So we can think of finer ways to become healthier. I remember about a month ago or 2 months ago, I was in here with Simon and we were getting ready for the webinar, running around the clinic and stuff. And my blood pressure was 160 over 100, and Simon looked really worried, and he measured it again. It was 165 over 110. I wasn't particularly worried because that was just the stress of running to get to this webinar, checking things, seeing patients. Then I measured my blood pressure on the weekend, and it was 120 over 80 range a bunch of times. Also, too, I had a 24-hour blood pressure machine about a month before then. My daytime average was around 122 over 70. So, blood pressure does go up, and it's the average blood pressure that's important. And we have to also say that there's downsides of over-treatment of blood pressure. If you lower blood pressure too much, you might feel dizzy, you might pass out, you might affect your kidneys in a adverse effect. You can cause electrolyte changes, and so you have to really work hard at this. And one of the things that really I feel really sad about is that alcohol right now, as it's the recommendation for alcohol is 0 to 2 drinks a week. There's no safe amount of alcohol. Alcohol causes at least 7 cancers. It also causes blood pressure to go up. It causes atrial fibrillation and many forms of heart disease, Alzheimer's disease, bleeding problems. So unfortunately, that's the bad news. The good news is that you can change that course if you choose to look at that. So many things to look at that in that area. So thank you for sharing this. And also too, that most people with serious high blood pressure will require 2 to 4 drugs to control their blood pressure, or better lifestyle changes and less medication. So very important consideration. Thank you. Next slide, please.
So now I want to talk a bit about the kidneys and why they're so vital in terms of regulating your blood pressure. What are the functions before we get into it? Well, there's 5 different ones, and the first 2 are probably more important. So number 1, it removes waste and extra fluid. The kidneys cleanse the blood of the toxins. It transforms all of that waste into your urine. And the kidneys filter almost like 200 liters of fluid every day, excreting about only 1.5 liters. So that's a crazy ratio, 200 liters to just into your urine, only 1.5. Number 2, and this one's also really important, obviously it controls your blood pressure. We'll talk about how it does that, but mainly it can constrict or expand your blood vessels. Number three, it makes red blood cells. Red blood cells, it produces this hormone called erythropoietin, and erythropoietin tells your bone marrows to make more red blood cells. And red blood cells are the things in your blood that carry oxygen. So that's why it's so important. Number four, it keeps your bones healthy. The kidneys make an active form of vitamin D, and we all need to take vitamin D to absorb calcium and phosphorus. These are essential minerals that make our bones stronger. And number five, it controls your pH levels. We're always consuming different levels of acids and bases. And it's important that your blood is within the optimal range. And that's why your kidneys are so vital, is to regulate your different levels of acids and bases. But mainly I want to talk about that second function in terms of how your kidneys regulate blood pressure. And we'll go to the next slide. So they do it through the renin-angiotensin-aldosterone system. I know that's a mouthful, and I just call it RAS myself. But renin and aldosterone are two key hormones that help your kidney to regulate blood pressure. So renin, it's something produced by the kidneys, and what it does when it's released. So it's released when your blood pressure falls. Your kidneys then secrete renin. Renin will constrict your blood vessels and it will increase your blood pressure. If your kidneys aren't functioning correctly, however, if you have chronic kidney disease, for example, you might be producing too much renin, and that increases your blood pressure and makes you susceptible to hypertension. And so this is why a lot of people with kidney disease have high blood pressure. That second hormone that's really important is aldosterone. Now, aldosterone, it's a steroid hormone. It's not produced by your kidneys. It's produced by the adrenal cortex, that gland sitting on top of the kidney in the picture. And while aldosterone is important is because it keeps the water to salt ratio in balance. It keeps the sodium in and it releases the potassium from your body. Now, you could imagine if you have too much aldosterone, you're going to be keeping in too much sodium, and therefore you're going to have high blood pressure. Why is that? That's because, as we learned in anatomy class many times, water follows sodium, water follows salt. And so if you consume more salt, you have more water, more blood volume, and hence more blood pressure.
So this is actually a very interesting slide. You can see how the body works. Everything has to be in concert. You have the kidneys that you mentioned that regulate your fluid balance, your electrolytes, and they send off hormones that direct flow. I'll remind people that COVID comes in binds to something called the angiotensin II receptor, and that's a receptor that's the key for COVID to get into all your cells in your body, and they line all your blood vessels. They also, they're in the brain, they're all over the body. And that's what makes me worried about COVID. It attacks blood vessels in part. And so that's why there's more heart attacks, more strokes. And remember, initially COVID came around, is that it really causes a severe COVID infection would actually shrink the brain to equivalent to losing 20 years of brain life. I'll repeat that. If you were part of the initial cohort with COVID and you had you're hospitalized with infection, you lost 20 years of brain health. I don't know about you, is that I'm in my mid-60s, early to mid-60s, and my brain is not the same as my 20-year-old brain. And losing 20 years is really something. Now, the good news is COVID is not as strong and is not as severe, but COVID damages blood vessels, it damages your brain, it damages your heart, damages your kidneys, damages your pancreas, it damages almost every organ system, because where you have blood supply, COVID goes. And so right now is that people can say all the things you want to. I'm trying to protect myself for future vascular insults, future brain attacks, future strokes. So what I'm currently doing right now is I'm getting a vaccine every 6 months, or if you get COVID, that to me counts as the same type of effect for protection. We're used to getting influenza shots every year. And it looks like right now is every 6 months or so is a good place for get a COVID vaccine who want protection. I would rather get COVID being vaccinated than unvaccinated. And this information will change as time goes on. So as of today, that's my recommendation for most people. But I'm sure tomorrow that will change, and you'll see different opinions from different people. But I'm privileged to speak to a lot of very expert people in the matter, and I'll share that with you right now. So So again, as I learned the ACE pathway of angiotensin system, as we learned here for blood pressure, but it's also involved in other parts of the system. And it's too bad that a virus has found that way to get into your body through that AT, angiotensin 2 receptor, the key to getting into lots of your cells. But we also use it to manage blood pressure, manage heart failure, protect kidneys. So for instance, if we use medication, ACE inhibition, AT1 blockade, these medications are protecting blood pressure, but also protect the kidneys independent of blood pressure effect. We use that mostly in diabetics, for instance. So these medications have far-reaching effects beyond just blood pressure control. Thanks for sharing that. Tell us more.
Awesome. Yeah. Thank you so much, Awesome, for that that description of, what is blood pressure? How do the kidneys work to sort of help maintain your body's blood pressure? Now we're going to talk a little bit about how diuretics work and sort of act on that system to help maintain or help regulate your blood pressure. So first things first, you can look at the diagram on the right, and it basically helps illustrate how the kidney helps or works towards filtering out your blood. So you can see on the left-hand side, you have these arteries going in over the arterioles that then go into capillaries, and blood is going to filter, not blood, but the different substances such as sugars, amino acids, different minerals and ions like sodium. They're going to filter out into this system where basically, in a simplified version, we're going to either pump in or pump out, different ions and water as the filtrate progresses through the system. And at the very end, in this collecting duct, what we're going to hope to get is we're going to hopefully get some water, we're going to get some ions, and depending on whether or not we want to keep water in or we want to get rid of water, depending on what kind of balance we're having at that particular point in time, the fluid in this collecting duct is either going to be very concentrated, so it's going to have a lot of ions, or it's going to be very dilute. It's going to have a lot of water and not many ions. And so how diuretics work is they basically help keep the ions, lower the sodium's reabsorption. So they basically make sure that sodium stays within this system and is eventually released by the body. And the reason that's so important is because, as Awesome discussed, water follows salt via osmosis. And so if we prevent the kidney from reabsorbing all this sodium, water is going to follow in the collecting duct. So we're going to make sure we lose more water that way. And that leads to more fluid loss, which can help lower your blood pressure, and it can help get rid of, any excess fluids. It can help with volume control as well. Now, the one thing to note here is that there are different parts of this system. It's known as a nephron, and essentially diuretics can act on different components of this system. So we're going to talk about some different classes of diuretics, and each of these different classes is going to act on a different component of this particular filtering system. So, you'll see that sodium can be reabsorbed from a variety of different points, and a lot of the time we use more than one diuretic to help manage this fluid control. So the mechanism will depend on the subtype. So moving on, we can talk about one good example of a diuretic that is very, very frequently used. It's called a loop diuretic. So its mechanism of action is that it inhibits a sodium transporter in what we call the thick ascending limb. So if we go back to the original slide, that is the component where the filtrate comes back up, and usually ions are essentially reabsorbed back into the blood. However, by inhibiting the sodium transporter, all these ions can't come back into the blood, and essentially we can prevent those ions from leaving, and they'll stay within the filtrate. Now, this particular system, or this thick ascending limb, is normally responsible for reabsorbing about 25% of our sodium load or our sodium intake. And so it can increase water and sodium loss if we inhibit this transporter. And a lot of people do consider loop diuretics to be the most effective one because the particular area that they're affecting here has a very high sodium reabsorption capacity. All right. We're going to move on to thiazide diuretics, and these essentially act on a slightly different area within the kidney. So they'll inhibit sodium chlorine transporters in the distal tube. So these kinds of transporters are responsible for pumping sodium back into the blood and pumping chlorine into the filtrate in order to balance that combination of ions within your urine. And so this portion is a little bit smaller. It only reabsorbs about 5% of your sodium load. So these kinds of diuretics are a little bit less efficacious than loop diuretics. They're a little less effective because the area that they're acting on is a little less potent in terms of the amount of sodium it typically reabsorbs. However, both of them can lead to an interesting side effect, which is potassium loss, because a lot of the times potassium will be transported with sodium, and it can lead to hypokalemia, or a lack of potassium. All right, and the last one we're going to talk about here, actually, no, there's one more, but we're going to briefly talk about potassium-sparing diuretics. Now, the last two we've talked about have affected sodium transport proteins that are responsible for moving sodium into the blood and moving other ions back out into the filtrate. This potassium-sparing diuretic will act in a very slightly different way. What it instead does, it acts as an antagonist for the previously discussed hormone aldosterone that Awesome talked about, which, as we know, and as he mentioned, it typically causes sodium to be reabsorbed. It's responsible for raising your blood pressure. And so, a lot of smart people thought, if we inhibit this, the action of this hormone, and we mitigate the effects of this hormone, we can basically prevent sodium reabsorption. We can keep it within that filtrate or that urine, and we can cause that ion loss. We can cause that water loss to follow, which also has the added benefit of not producing the same hypokalemia effects or the reduced sodium or potassium that are often seen with loop and thiazide diuretics. However, it's also important to note that these have relatively weak effects on sodium balance. And so it's a bit of a give and take here. If you want to use something that's very potent, we could use a loop diuretic, but then those also come with certain side effects as well. Last but not least, we're going to briefly discuss the mechanism of carbonic anhydrase diuretics. These are a little less common, but they're used to inhibit bicarbonate transport out of one last section of the kidney that's called the proximal convoluted tubule. This leads to less sodium reabsorption, but these are also the weakest diuretics, and they're not really used too much for cardiovascular disease. And so, they're a little less relevant in this particular scenario. All right. Now we're going to move on to Martin, and he's going to give us a little bit of a talk about the different types of diuretics you might see in clinic.
Hi, so I'll be giving a quick brief summary about the types of diuretics that were just mentioned. Just to reiterate, so each type of diuretic affects a different part of the kidneys. Their mechanism of action may be slightly different, but their overall effect should be similar. Some medications may combine more than one type of diuretic in one pill. So, for example, some pills also have a combination of a diuretic with another type of blood pressure medication. So one example of this is benazepril, which is an ACE inhibitor plus a thiazide diuretic. And the generic name for this is hydrochlorothiazide. They work by relaxing blood vessels and by removing excess water and salt from the body, similar to the mechanisms that were already talked about. Next slide, please. So the three main types of diuretics that we might see in clinic include the thiazides, the loop diuretics, and the potassium-sparing diuretics. So first off, the thiazides, these will be the most commonly prescribed. They target the distal convoluted tubule of the nephrons inside the kidneys by blocking sodium and chloride ion channels. Thus, this inhibits the reabsorption of sodium and water into the body and will help with high volume of fluids. Thiazides in sufficient concentrations also relaxes our blood vessels. And thus, these two mechanisms, although appearing a little separate, both work together to relieve high blood pressure or hypertension. On this diagram on the right, on this diagram on the right, we can also see in the top half where it's labeled thiazides. That's where the distal convoluted tubule inside the kidney is. In Alex's diagram previously, also, right where the cursor is pointing, that's where these medications will take action within the kidneys. Next, please. So some examples of thiazide medications include chlorothiazide, chlorothalidone, hydrochlorothiazide, indapamide, and metolazone. So as we can see, the uncapitalized names on the left, those will be the generic names that are just the active ingredients of each medication. but the names that are capitalized are the brand names. So these will be specific to the manufacturer or the pharmaceutical company which are producing these medications. Very commonly, you might see them in a pill form, but sometimes, such as in this example of Diurel, it might appear as an oral suspension. Also, for thiazides, notice how the suffix or the ending of these medications tend to end in thiazide. However, there are some exceptions, such as indapamide. Next, please. So for our next category, loop diuretics, these medications target the thick ascending limb of the loop of Henle inside the kidneys. Similarly, they also reduce sodium and chloride reabsorption, and that is how they help with relieving high blood pressure. As we can see on this diagram, it will be on right between that line near where the cortex and the medulla are divided. That's the thick ascending limb on the latter part of the loop of Henle. Next, please. And now for some loop diuretic examples. So these may include bumetanide or Bumex, epincrinic acid, Edicrin, furosemide or the brand name Lasix, or torsemide, which is the brand name Soans. Now, also something important to point out is that perhaps depending on location or availability, each generic drug may have multiple brands which produce them, especially if like a patent has already originally expired. So these are just the common ones that we might see the most often in clinic. Next slide, please.
If you go back, yeah, that's a good slide. Go back to that slide. The next slide here. Go forward one slide. Okay, this is, thank you for showing us some pathophysiology, what a nephron looks like. So basically nephrons are, you have blood going in through the afferent vessel and coming out through the efferent vessel. So it brings in blood, and you mentioned it's a filter. Basically, the kidneys are a series of about, each of us have about 1 million nephrons in each kidney. So it's about 2 million nephrons that we start off with, 2 million filters. And as we get older, they start to decay and break down. So it's amazing how the body has lots of redundancy. And by keeping the pressure in the body, it's just at the right level, you preserve the function of them and you help. Now, if you go back one slide, is that we have different forms of diuretic therapy. Just back up one slide if you can, that's okay. So the workhorse of diuretics to get rid of volume or fluid is furosemide Lasix. It costs pennies a day. We have in Canada Bumex, and basically it's depending on the dose that you're using, it can be $10 a day versus pennies a day. There's a trial that was just presented looking at torsemide versus Lasix, was done by the VA hospital system in the States. And we had the impression that drugs like torsemide or Bumex have better properties, but if you use them properly, it showed that there was no difference. And so so we're learning a lot and learning how to use these medications. And this medication has two names, a trade name and a generic name. And then is that after a certain amount of years for patency protection, they're made generic, and the prices come down substantially. And it still has the same active ingredient. So I think there's so much to say, so much to learn, and reminds me is that don't be afraid to discuss cost with your pharmacist and with your doctors, because I know how to make things more affordable in many circumstances. Some things are not able to do that, but many times we can actually bring the price to different levels. We have many options. So thank you for sharing this. Just keep going forward. Thank you for pausing for me. Thank you.
Yeah, of course. So now with our last category, potassium-sparing diuretics, these target the collecting duct of the nephrons in the kidneys, and also similarly interfere with the reabsorption of salt and water. So these have the ability to reduce fluid levels in the body, but significantly without losing potassium, which is an important nutrient. The loss of potassium is actually a side effect of the other diuretics that we may have mentioned earlier. So these potassium-sparing diuretics would be most useful to patients who are already at risk of low potassium levels, or also those taking other medications which deplete potassium. So an example of this might be those taking beta agonists for asthma. So the one downside for these potassium-sparing diuretics is that they do have a relatively weaker diuretic effect. So thus, they are often combined with other medications which work together to lower blood pressure. Next slide, please.
Actually, just stay on that slide for a sec. Go back one more slide over here. It's very interesting is that you're right, they're a weaker form of diuretics, but we also learned that they actually block neurohormones. So spironolactone that we tend to utilize at around 25 milligrams a day, it's been shown to be a life-saving medication in congestive heart failure. And it doesn't function as a diuretic because the weights were no different. So it was working as decreasing scar tissue fibrosis and blocking neurohormones. And so many of these medications have multiple properties to them. And so I use a lot of spironolactone, not as a diuretic, but as a way to actually make the heart muscle stronger if your heart muscle is weak. And if your heart becomes stiff or has scar tissue in it, it's an anti-scarring medication that's been shown to be of value in both people who have a weak heart and a strong heart with a stiffened heart muscle. And also it's been shown that in people who have very difficult to manage high blood pressure, it's been tested against 3 other drugs, and it came out as a clear winner in lowering blood pressure by blocking neurohormones in a non-diuretic effect. So you're putting the diuretic effect, which is important, but it also can work differently. Now, this drug also can cause potassium to rise. So if you're dehydrated, you have diarrhea, you're not eating or drinking properly, that medication needs to be stopped temporarily for periods of time. And so it's really important that you know what medications you're taking and know what to do when something has potential for going wrong. So go ahead, tell us more.
Yeah, of course. So now moving on to some of the examples of these potassium-sparing diuretics, we have amiloride, which goes under the trade name Metamor, eplerenone under the trade name Inspra, and then the mentioned spironolactone, which there's 2 common trade names that it's available in. So aldactone and carospir. And lastly, we also have triamterene, which goes under the trade name of Diurenium.
So if you look at this, people should pause. If people are taking any one of these medications, you have to have a plan of action if your blood pressure is too low, or if your potassium level goes too high, or you're dehydrated. So these medications demand that you keep an eye on your electrolytes and kidney function. It's been shown that these drugs are instrumental in the management of many diseases, but also I need to respect them and know how to monitor them properly. And that's why you should need to work with your doctors. And this is something that I feel very strongly about, is that it's better to work together. And when I hear people say, you know what I'm taking, the answer is no, you know what you're taking. I know what I prescribe. Pharmacist gave you. I don't know what other doctors have changed things to, and so so it's really up to you right now to know what you're taking, know how many pills you have left, and when you need prescription renewal, so you can do it in a safe fashion. I'm seeing too many times people saying, "Well, the pharmacist will call you." Somehow the pharmacist keeps track of things. The pharmacist only knows how many pills you have left. Doesn't know your blood work, doesn't know your medical status whatsoever. So really important to work with your doctors in this area. And the most common cause of a reversible medical error is medications. I'll repeat that. The most common cause of a reversible medical error is medication. These categories of medications can lead to medical errors if they're not used properly. And you really need to know what you're taking and what proper blood work and how to have a game plan when it comes to this. I'm saddened to see that too many people don't want to be part of that. So if you can rely on that the pharmacist is going to somehow mysteriously send prescription renewals to your doctor. Myself as a doctor, I really don't like to renew medications unless I see you, talk to you, know what combinations that you're taking. and make sure it's right for you at that point in time. So very important observation, especially with this class of medication. Next slide, please.
Yeah, that's great advice. Now, moving on to some of the most common use case for diuretics. So that would be for high blood pressure, are also known as hypertension, and thiazides are used a lot for this use case. All diuretic types, however, will reduce the reabsorption of sodium in some way. And referring back to the mechanisms that were discussed earlier, in the kidneys, water follows where sodium goes. So to maintain a similar ratio of concentrations between water and sodium, this can be thought out as kind of like a scale or as a balancing effect. So the more water that is excreted as urine, there will be less water reabsorbed by the body. And if there's less water in our blood, this will help reduce the pressure that is applied on our vessel walls. So as we can see in the diagram below, the blood vessel on the bottom, that's normal volemic with a normal blood pressure. But when someone has hypertension, that's hypervolemic, and that's increased pressure. As we can see, there's excess volume of fluid that's pushing against the blood vessels outwards, as indicated by the white arrows. Next slide, please. So now we'll go over quickly some other uses for diuretics. So another use for diuretics include for edema due to congestive heart failure or cardiomyopathy. So in these cases, the heart fails to pump blood effectively throughout the body, and this can result in a buildup of fluids leading to swelling. This is especially common in the calves, the ankle, feet, and etc. So diuretic medications can help reduce this buildup, and what tends to be recommended is furosemide. And as we can see in this diagram, that on the left is a normal foot, and on the right is a foot with edema, and we can see that swelling is due to the fluid buildup that is caused by the congestive heart failure or cardiomyopathy. Next, please.
Actually, go back again. I love that slide. So one of the things is that we'll make you a heart doctor, a cardiologist. So lake swelling does not mean always congestive heart failure, but it's certainly a possibility. I always think about it as your basement's flooded, it goes into your lungs. And it also can go into your feet as well. So if you're gaining weight, if you gain more than 1 or 2 pounds in a day, that's fluid. And it could be congestive heart failure and getting shorter breaths. It also could mean that you haven't walked. You have certain medications that can make your feet swell, which is called calcium blockers. But just so that can be a barrage or a way of monitoring for heart failure. So keep that in mind if your legs are swelling that's changed. It could mean that you're just overweight and you're not moving around and you don't have good return of circulation from your legs to the rest of your body. But just take a picture of that and think about, could I have congestive heart failure? That's one of the clues that you might see. Go ahead.
Yes, and so now our next other use case for diuretics may be for ascites due to cirrhosis, which is liver failure. So this is not entirely common, but some liver failure patients may have ascites, which is an increased absorption of sodium and resulting in fluid buildup. But as opposed to our previous case of fluid buildup in the feet or toes, ascites will result in fluid buildup in the abdomen. But however, this can also be treated with diuretics. So very commonly, spironolactone may be prescribed, which is a potassium-sparing diuretic. And this might be the most common diuretic prescribed in this situation. As we can see in the diagram below, in the abdominal cavity, a normal abdomen should be closely resembling the abdomen on the left, whereas one with ascites will have a swollen belly and extra fluid that is resembling the diagram on the right. Next slide, please. And now one last use case for diuretics that we'll talk about today are for kidney stones. So a side mechanism of thiazide diuretics are actually reducing the amount of calcium released into urine. So diuretics can actually help prevent the recurrence of kidney stones, especially in patients who already have high levels of calcium in their urine. Thiazides are the most recommended for this use case. Some examples include hydrochlorothiazide, chlorphalidone, or indapamide. And as we see on our diagram here, so kidney stones can actually form in various places of the kidney, such as in the minor or major calyces. And this can be a painful condition, such that it should be addressed and treated very promptly.
All right, thank you for that, Martin. We're going to wrap up really quickly with a quick discussion about some different side effects that you might see if you do take certain diuretics, and then we're going to conclude really quickly and just talk about some questions that people have submitted. So in terms of side effects with thiazides, you might see, things like loss of appetite, hair loss, headaches, loop diuretics, some dizziness, looseness of the bowels, upset stomach, potassium-sparing diuretics, gas, nausea, headaches. Serious side effects could include allergic reactions. If you know that, you might be allergic, that's something to be very wary about. Could cause kidney failure or arrhythmias, but these are very rare. And so these aren't something that will frequently occur in many patients, which is why we still value the use of diuretics in order to cause all the beneficial effects that we talked about earlier. Okay, regarding drug-drug interactions, if you have, any conditions such as diabetes, pancreatitis, lupus, gout, any menstrual problems, kidney problems, or dehydration, there may be some effects when you take diuretics, so just to be careful about that. And you're potentially taking certain drugs such as cyclosporin, antidepressants, lithium, digoxin, or other drugs for high blood pressure, which is why it's important to have a quick chat with your healthcare provider before you undergo any of these. And it's important for your healthcare provider to know your medical information so they can make the best decision based on your total family history and your total medical history as well. All right, so in conclusion, we really appreciate you staying with us and sort of being with us for this exploration of diuretics, how they work, what they're used for, and what to watch out for when taking them. If you have any questions, you can send us an email. You can drop them in the chat. We'd be more than happy to take a look at them. Awesome has left and Dr. Curnew has returned. Very quickly, I think we did have some questions from earlier. Let me see if I can find them.
Sorry, guys, I lost you guys.
Yep. Hi, Dr. Curnew. We just wrapped up the presentation, actually. Would you like to sort of conclude with some remarks?
Sure. So you can see that internet is always unreliable, so our medication list, so just keep it up to date right now. So I want to thank the team for putting together a wonderful presentation. Remind us about how important diuretics are. They're extremely important class of medications to get rid of fluid and congestive heart failure, prevent you from having shortness of breath. You also mentioned things like in liver failure that's actually important too, as well as other disease processes. You also remind us that having high blood pressure is not a good thing. It damages your vessels, also to your body, from your brain to your heart to your kidneys. And good control and knowing your blood pressure are key factors. Thiazide diuretics have been around for a long time. They're well utilized, and most people who have trouble with diuretics is that for us guys, we could develop a prostate problem. So we need to address that issue. Also, too, as we get older and more fragile, we can lose our balances and knowing your blood pressure. So sometimes we have to actually cut back and let the blood pressure drift higher. And so that's important in that circumstance. So thiazide diuretics, if you take them every day, after about a week or two, you won't pee more. You'll get to a new steady state. Furosemide is a really important medication to treat congestive heart failure. It's not a very good medication for high blood pressure because it acts for just a few hours. So, for instance, if you have congestive heart failure, you'll take your water pill, let's say first thing in the morning, and a few hours later, it will be out of your system. You've gone to the bathroom, you can get your daily work done. And if you need to have a second dose, you can come back mid-afternoon and get a second dose if that's necessary. Spironolactone has magical properties. It's a very important drug for resistant high blood pressure. It's a drug to in liver failure. It's a drug for congestive heart failure management. So that's wonderful. I noticed that we have our colleagues there on their, not sure if Joanne and her husband are there right now. Do they have any comments? That they've been around medicine for a long time, and they've used Diuretics as part of their repertoire. What's your thoughts?
Can you hear me okay?
Yeah, we can hear you. Good to hear
Yeah.
from you.
Oh, good. Yeah. Well, first of all, I want to congratulate the students on a complicated subject, and it was nice to be reminded of the physiology and how the drugs work. And I thought they put a lot of work into that, Greg. I want to congratulate them. And I think now Joanna and I, now we really do geriatrics, and these drugs are extremely important in people with heart failure. We do get into this problem with their renal, with their kidney function being poor. We have to be very careful with all drugs, but particularly these drugs, because they can push their kidneys into more heart failure, kidney failure. And you can get potassiums very high. So we have to closely monitor them. I was interesting, we're on a talk earlier this week, Greg, and there's a new mineral corticoid, like spironolactone. What's it called again, Joanna?
Finerenone.
Finerenone. I don't know if you've had any experience with it yet, Greg. In the States, it's like $27 a pill. And it's right now licensed for use in chronic kidney disease to preserve the kidney. So that's something maybe we'll talk about later.
Yeah, so
I think
we have spironolactone that we can use in that circumstance. So I think
exactly.
So we got lots of choice.
The only advantage that they said is there's less, breast enlargement and sexual side effects with these newer drugs. So I don't know. But anyway, I think, they need monitoring. But Greg, Dr. Curnew, you're perfectly right on the money there, that people have to take their medication. Their side effects decrease the longer they're on them. Watch the blood pressure. And if they see their swelling or shortness of breath or things aren't controlled, obviously you're going to get in touch with your doctor, Dr. Curnew, and he'll make adjustments. Do you have anything to add, Joanna?
The students did point out that there's drug-drug interactions, and I think that's important too. So thank you very much for the good work that was done.
Okay.
So the biggest mistake
Anything
you
else?
see with diuretics is that we underuse them. We don't use the proper doses. And so if you're in congestive heart failure, you need to diurese the person, and the kidneys will be okay in the long run. So thank you all, everybody, and so let's all work together. And I'll give the last word to Daniel.
Yeah, thanks, Dr. Curnew. No, I think the team has really put on like a fantastic presentation about diuretics, and I think my biggest takeaway is, like, in terms of these diuretics, they're wonderful drugs, absolutely wonderful drugs, but they do require a lot of effort and monitoring on the side of the patients. It's just watching your blood pressure at home, because they do reduce blood pressure, keeping an eye on your potassium levels, because they may influence your potassium levels, and so you got to do frequent blood work. So I think if you are taking a diuretic, I think the key takeaway message is just being on top of your medical history and following up with your family doctor or your doctor just in general. And yeah, I think just putting in some effort is required when you're on a diuretic. Yeah, but I guess other than that, I hope everyone enjoyed this webinar, and have a great night, everyone.
Good night, everyone.